already a mother, so
couldn't tell.
There's that.
Let us know down in the comments. The racial aspect of U.S. health care. Why do you think America doesn't have universal health care? I'm not going to even delve into it. I'm going to just let you watch the video. Check it out.
The reason right now, the reason we have no safety net in this country relative to those nations that we like to compare ourselves to is precisely because of the racial resentment that says we don't want those people getting over. There was actually a study done on healthcare internationally. They found the single biggest factor to explain why the United States does not have universal healthcare relative to Western industrialized nations. They figured out all these different elements. And they did what they call the regression analysis, big social science term, where they control for all these different factors. They found the single biggest correlated factor with the opposition to universal health care in this country was the belief that black folk would abuse the program. So now you got millions of white folk without health care, but by God, at least those black folks aren't getting over. This is what W.E.B. Du Bois called the psychological wage of whiteness. Right? It doesn't pay your bills, but psychologically it tells you, well, I might not have much, but at least I'm not black. At least I'm not brown. At least I'm not red. At least I'm not a person of color. But see, at the end of the day, that doesn't put your kid through college. It doesn't pay the emergency room bills, and it doesn't pay your house note. We've got to be willing to have this conversation. Sadly, as a country, we're running away from it. Trying to downplay the issue of race, trying to talk about class in a vacuum to try to bring everybody on board, afraid that if we talk about race, working class white folks will bolt from any progressive movement. But what working class white folks got to understand is the very reason that they're hurting. The very reason that they're so disempowered is because of racial inequity. In other words, they were not the targets of it. To be sure, people of color were, but those of us who were white become, over time, the collateral damage of a system of white supremacy and racial inequity. So we need to be clear on it.
Yeah, 1945, when President Truman called on Congress to expand the nation's hospital system as a part of the larger health care plan, Southern Democrats obtained key concessions that shaped the American medical landscape to keep blacks out. They think the reason that we don't have universal health care, as you heard in the video, is because black people will abuse it. Same thing Ronald Reagan said, black welfare queens. Most people on welfare are who?
85% of welfare and food stamp recipients are white, live in southern red states, and vote for Republicans who want to take that away from them, by the way. Go figure.
That part. So now you're saying that we're going to be the ones. You just don't want to help black people. You heard the guy in the video earlier. The America ain't trying to help black people. If you haven't seen that video, go check it out. But America ain't trying to help black people. That's why we don't have universal health care. We was another country and we were homogenous and we were just those people, we would have health care. But 150 years after the freed people of the South first petitioned the government for basic medical care, the United States remains the only high-income country in the world where such care is not guaranteed for every citizen. If they think black folk gonna get it, they're gonna vote against it. Therefore, you're voting against your own best interests. And now everyone else ain't got health care. You got all the money in the world to do everything for everybody else except your own damn people. And that shit gonna come back to bite you in the ass. Remember the guy who said when they had let him in, y'all stupid because you don't know who I am, but you gonna find out who I am. So how many more like him are in here?
Yeah.
This shit gonna backfire on these white folks' mind.
He was an arms dealer.
He's done overthrown governments and some more shit. Mm-hmm. It's going to backfire. Everything. When you white folks are like, yeah, he's talking about race. Yeah, because it's baked into the fabric of America. Everything is race. What did you say the other day? If race didn't matter, why is it on every application?
Right. If race don't matter, why do you ask on when I'm trying to fill out an application for anything?
Yeah.
Every application, you want to know what my ethnicity is and whether I'm a male or a female and all of that.
So if it didn't matter.
Why does that matter? Why is it on there if it doesn't matter?
Why is it on there if it doesn't matter?
Hey, good morning, Nikki Haley. Remember when you said that America is not and has never been a racist nation? Well, if that's the case, why don't we have universal health care? The answer is simple. Racism. Don't believe me? Watch this.
It really began in the 1880s, 1890s when medicine became a thing. And there was this guy named Frederick Ludwig Hoffman who came over here from Germany. And he was a young man. He was 17, in fact, when he came over, and was a numbers genius. And he hooked up with the Prudential Life Insurance Company, ended up being a vice president. And he was the guy who figured out that there was an association, a statistical association between working in a cotton mill and having lung problems, asbestos and mesothelioma, smoking and lung cancer. He published on that in the 1910s, in the 1890s and 1910s. And diet and cancer. In fact, his book on the association between a high processed food diet and cancer is still in print. He's been dead since 1946, but his book is still around. So he's really smart in these things. And so he married this Southern belle from Georgia who was from a racist plantation family. And so he ran the numbers on black people and found that black people were dying, dropping like flies, more likely to be sick, more likely to die of pretty much everything, and concluded, which was the general consensus at the time among a lot of white people in the South, this is again in the 1890s, that black people were genetically inferior. And in 1896, he published a book called Race, Tendencies, and Traits of the American Negro, in which he lays out all the numbers, and then he concludes that if we simply avoided allowing black people to have any access to health care, that within 2 or 3 generations, the whole race would die out, and that would solve the race problem in America. Now, it sounds kind of crazy when I just lay it out like that right now, but this led to a whole bunch of things. By the 1920s, this was referred to as scientific racism. He was testifying about it before Congress. When Teddy Roosevelt, 1912, proposed a national health care system, people said no because black people will get it. When Franklin Roosevelt proposed a national health care system, it was the same thing. We don't want black people to get it. When Truman tried it in 47, same thing. Don't want black people to get it. Right up until 1965, Senator Stennis, the Dixiecrats in the South, was quoting Hoffman, who was by then dead, but is still very famous in this field, as saying this, we have to figure out a way to keep black people from using Medicare. This is when they were passing Medicare. And the way that they came up with was to have a 20% a gap in Medicare, so that you had to pay 20% of your doctor's bill and your hospital bill, and that would discourage poor black people from showing up at the hospitals. I mean, it was the most shocking thing I discovered, Cenk, when I was doing the research on this book, is that nearly 100% of the reason why the United States is the only country in the world that doesn't define healthcare as a right and doesn't have any sort of national healthcare system to speak of is because of racism.
If it doesn't matter.
And
that's why you don't have universal health care. They want to beat down Canada. Oh, it's socialism. Why aren't you helping the people who are the taxpayers who make the country run? Okay. In 2010, the Affordable Care Act brought health insurance to nearly 20 million people. And then here's what's so stupid to show you, like Jackie said, people don't pay attention or be reading. You go ask people, them folk, do you think we should get rid of Obamacare? Oh yeah, we don't need to have that. People need to pay for their own health care. People need to do this, that.
I remember that.
Do you think we need to get rid of the Affordable Care Act? Oh, no. We need to keep that. Nigga, the Affordable Care Act is Obamacare. Them folks start calling it Obamacare up in the Senate and Congress. Mm-hmm. It's the same thing, different names. Show you how stupid people are. The biggest beneficiaries of this boom were people of color, many of whom obtained coverage through the law's Medicaid expression. They don't want you to have it. They don't want you to have it because they think black people are going to abuse the system. Who been abusing the system? Who been butt humping the government ever since? How do you be in the Senate, the Congress, working for the federal government, and you become a millionaire? You make $100,000, $200,000 a year. How Nancy Pelosi got $20 million? Sleepy Joe makes what, $400,000 a year? How the hell you got $10 million? Where'd that come from? Chuck Schumer, Ted Cruz. All these people are millionaires. How'd you become a damn millionaire on $200,000 a year? It would take you 5 years saving all your $200,000 to get $1 million. That's why we need term limits. Let us know what you think. Do you think the healthcare situation in America is racist? Do you think there's a racial aspect to healthcare? Do you think we need to have universal healthcare? We're the only country on the planet that run commercials about medicine and pills. Other countries don't do that. We do. Remember the one guy who had bought this one medical thing and raised this one medicine to $6,000?
Yeah.
Greed.
Yeah.
Greed only in America. Let us know what you think. Put it down in the comments. We would greatly appreciate it.
But you know, Mark Cuban have a pharmacy.
Yeah.
And with his, because just like you're saying, how the pharmaceuticals are so overcharging people for the price for their medicines.
Right.
He doesn't agree with that, and he doesn't think that they should be allowed to do that. Mm-hmm. And so he partnered with this company, and they have this pharmacy where there's an example. Mm-hmm. There is one medication that normally through the regular channel, through regular pharmacies, it would be over a $9,000 a month prescription. Wow. And through Mark Cuban's pharmacy, it's only $41. Mm-hmm. And so that's how big of a difference the prices for his medication is compared to norm. Yeah. And you don't have to have insurance to get medication through his pharmacy. So for those of you that struggle to get your medication, or if you know someone else that does, check out Mark's pharmacy. I can't remember right offhand what it's called, but if you Google Mark Cuban's pharmacy, it'll come up and you can check it out, because it will save even some people that have insurance. It will save them in some cases.
Now, we could have cheap or free medication, insulin and diabetes medicine and whatnot, if Jackie would donate her money to the reparations fund, okay?
And anyway, while you're talking about me, you would be worse than me.
What do you mean? I would donate. I would give.
You would donate, but you wouldn't want your money initially going to somewhere else, and then they're getting 50%.
I got a nice
you
chunk.
Would be worse than, boy, please.
And we have to correct people in there. Go check out that video.
17 years, honey. Trust me,
Dr.
you
Claude
would
Anderson.
not be this calm about nothing. So I don't know who
Dr. Claude
you fooling.
Anderson is talking about the effect on immigration on black people. And go check out that video of mine about immigration.
Don't believe him.
Anderson. Time now for your pushgapradio.com Jackie O Entertainment Report. What's the business?